Hi, I'm Dr. Jeff Stripling with Denver Chiropractic Center, and we're here again today at CrossFit Conquer in Denver, Colorado. Today we're going to talk a little bit about foot pain and plantar fasciitis. So the typical symptoms for plantar fasciitis is very sharp pain towards the heel when you first get out of bed in the morning, and it usually gradually loosens up throughout the day. The people that are most at risk for plantar fasciitis are runners, people who are overweight, pregnant women, and people with very flat arches like I have, or people with very, very high arches. And plantar fasciitis is almost a garbage bag term to identify any pain that you have in the foot. And if you look at the anatomy, the plantar fascia is actually a very superficial tissue, and there are many intrinsic structures within the foot that flex and adduct the toes, as well as the quadratus plantae and the very deep aponeurosis. And many times in the office when we're treating the bottom of the foot, I get on the plantar fasciitis and it's not very tender. So we actually have to push that aside to treat the deeper tissues. And if your practitioner is just treating the bottom of the foot, it's almost like putting a Band-Aid on a broken arm. There are many different things that can be causing this problem. And that's what we're really going to focus on today. So one thing that could be causing the problem is the dorsiflexion muscles in the front of the leg. This includes the tibialis anterior, the extensor digitorum longus, and the extensor hallucis longus. And these are the muscles that bring the foot up and the toes up. And when these muscles become very constricted, they will almost cause a slapping gait. So when you're running and walking, you're almost slapping down, and this is going to create tremendous stress on the bottom of the foot. And then if we move to the back side of the calf, along with the superficial muscles such as the gastrocnemius and the soleus, we have three very deep tissues called the Tom, Dick, and Harry muscles. And this is the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. And these three muscles, their insertion point actually wraps around behind the calcaneus or the heel. And when these muscles become very tight and constricted, it can actually create excessive pronation when you're walking or running, or excessive supination. And this will also affect the tissues. And at the bottom of the foot, when you start to get this pain, it's actually due to what's called a cumulative injury cycle. And this is very excessive stress, stretch, and tearing. And the tearing causes micro tears, which in turn create adhesions, which acts as a super glue to prevent the tissues from sliding over each other the way they should. And this is what is contributing to the decreased range of motion and increased pain. And along with the lower leg, what we often see in the office is people have very problems with the glutes and the rotators, especially like the piriformis. And when the glutes get very tight and constricted, it will actually torque the femur. And when the femur becomes torqued and out of position like this, it creates increased stress through the entire kinetic chain, down to the knee, the lower leg, and into those tissues at the bottom of the foot. And this could also be causing your plantar fasciitis. So today we're going to do a few stretches, exercises, and trigger point therapies just to get you on the road for recovery. The first thing we're going to do is a gastrocnemius stretch. So we're going to come over here. Just come against the wall, and you're going to keep this back leg straight, and just really lean into it, and you should feel that stretch right at the top or the lower leg. And ideally, all these stretches that we're doing, we want to be doing them multiple times a day for about 10 to 15 seconds, but if necessary, you can do it for about 45 seconds after you work out as a static stretch. So the next one is going to target the soleus muscle, which is a little bit deeper and a little bit lower. So it's going to be almost the same position, except you're going to bend the back knee. And you should feel that stretch right almost above your Achilles tendon, right in this area. The next thing we're going to do is stretch the tibialis anterior. So what we're going to do for this, I'm going to try to do it with these pants, so hopefully they won't tear. So what we're going to do is, I'm just getting like a child's pose, and just kind of lean back, put your weight back. And you should really feel that stretch right on the anterior side of the leg. And again, do all three of these exercises many times a day for about 10 to 15 seconds each. The next thing we're going to do is a little trigger point therapy to target the gastrocnemius and the soleus muscles. So we're going to use lacrosse balls today, but like I mentioned in the first episode with the rotator cuff, you can do this with tennis balls at home. Actually, start with tennis balls and then gradually progress into lacrosse balls. So if you're familiar with yoga, this is a pigeon pose almost. And we're going to sandwich the lacrosse balls, so one right on top of the other. And we're going to start a little bit lower into the soleus muscle. So then you're going to place those right on top of each other, interlace your fingers, and then just use your body weight to lean into it. And you're just going to do small concentric circles. And for each area, we're going to do it about 15 seconds. And then we're going to slowly work up the entire belly of the gastrocnemius. And this is normal to be pretty tender. So as much tension as you want to put on it, just lean your body weight into it. And you can also start doing this maybe once or twice a day for about 15 seconds each area. And then the next one we have is actually going to strengthen the arch of the foot. So you're just going to stand up with the towel underneath, and you're just going to crunch up the toes. And you want to walk up the towel a little bit. You're going to want to do this about 3 reps for the towel. And this is going to strengthen all those flexor muscles like the inside of the foot as well as the plantar fasciitis. The next one we're going to do is just heel raises. So we're going to start we're really going to focus on the eccentric motions, the lengthening of the tissue. So you go against the wall and just get that good stretch, and then raise up all as far as you can up on the toes, and then come down, pause at the bottom, and come back up, and start with 2 sets of 20. And this is going to strengthen those 3 deep tissue muscles, the tom, neck, and hairy muscles, as well as the gastrocnemius and soleus muscles. And one other thing you can do besides what we showed you today, I ice it a lot right towards, usually the pain is going to be right next to the heel here, so you can ice it a lot, which will help with that inflammation, as well as using a night splint, which is going to keep that foot stretched out throughout the night. So along with what we showed you today, active release in the office works great for plantar fasciitis. And basically what we're doing there is shortening the tissues. So we're breaking up all that scar tissue and adhesions. So we shorten the tissues, and then we lengthen them while contacting those adhesions, which breaks them up. So that helps improve range of motion and decrease that pain. And today, that's all we have for you today. So join us next week for our next condition. Thanks a lot.